Hey guys, thanks for joining me today. I'm Dr. Amit Gosalia. Today, I'm interviewing Dr. Robin Carson and Dr. Erich Gessling of Carson Hearing Care in Fort Worth, Texas. But we're not talking about their private practice. We're actually talking about a tool that they've developed called HearVu. And stay tuned for the very end because they've got a fantastic offer for everyone watching. Here we go. Hey guys, thanks for joining us today. I'm joined by Dr. Robin Carson and Dr. Erich Gessling of Carson Hearing Care in Fort Worth, Texas. And they're also here representing HearVu. And I'll jump into HearVu in just a few moments. But first, before I really jump in, I want to talk to you, Dr. Carson. You are the owner and founder of Carson Hearing Care in Fort Worth, Texas, and also a fellow Arizona School of Health Sciences grad. Go Artichokes. No, I don't know what. I don't know. I don't think we had a mascot, but I'm sure that probably would not have been it. But tell us a little bit about your journey into private practice.
Sure. I have been an audiologist for 25 years. About 8 years ago, I decided to take the leap and go into business for myself. I joke often that I am that technician who had the entrepreneurial seizure and believed I could go in and run a business. And, I threw the hat over a fence and had to chase it. So it's been a great journey. I have a practice here in Fort Worth, Texas. It's a single location. We have 3 audiologists. Dr. Erich Gessling was my first hire as a new doctor of audiology 4 years ago. He joined my team. Yep. And we recently hired an additional audiologist, and we have an audiology assistant that works with us as well. So it's been great. I love what I do. I feel blessed every day, and I have a great team of people.
Yeah, we like Amy. Met Amy back in Denver, the last AudBoss Summit. And so speaking of, throwing that hat and chasing after it. So Erich, you were actually teaching and then you joined your practice in 2017. So tell us why private practice for you as well.
Yeah, so I went to school and I was teaching undergrads through my so I was teaching a speech and hearing science course, but always knew, from the day I started in the program, I was going to do private practice, adults, hearing aids. From that. And so I was here at Carson for my 3rd year of my doctorate, 1 day a week. I did my whole 4th year here. Whenever I graduated, she hired me on. So it's been great. I've been here ever since.
Mm-hmm.
Yeah, it sounds like you guys have a great
Can't take them. Yeah. So here we are.
Here you are. Absolutely. And I keep seeing, I see all these great posts from you guys, and I see a lot of the great work you guys are doing. And recently I saw you guys were working Batlin Braden, our Marvel superhero, Braden Baker. He and his mom, Ashley, I've spoken to both of them, and they're just fantastic people. Tell us about that relationship and how that all started and where are you going with that?
Yeah, I have known Ashley even before I knew Braden. Our children go to the same school together. And so before I went into private practice, I always was aware, but we were never really pediatric audiologists, and that wasn't really our focus. And then through the community efforts that Carson Hearing Care has with give backs to the community, we've had opportunities to partner with Braden Baker and his fabulous organization and help put on some of the concerts and whatever we can do to support efforts with donation. We do a lot of battery donations for a month, and we might give them to Braden's association or program. And so it just seemed like as Ashley and I became closer and Braden got some exposure and spending time with us, it was a natural transition for him to kind of move on from his pediatric audiologist experience to more of an adult setting. And so we were really fortunate to have him at our practice and working side by side with Oticon with fitting him with the new more devices yesterday, actually. So it was a fun day.
Yeah, he kind of goes through that process of doing big BTEs with ear molds and then getting into a RIC and just that adult fitting. So it's really fun. Obviously he's still pediatric, but.
Sure. Yeah, I first heard about him, I think through Dr. Lisa Vaughn at this point. So I remember seeing that early on and again, just following his story. And I'm so happy to see you guys working with him and Ashley.
Yeah, he's a cool kid.
Yeah. And he's so motivating. I think he was on Ellen, right? On the Ellen show. And yeah, he's doing great things. And you guys are doing great things too. So, being in Texas, little plug here, I got invited to come speak at the Texas Academy of Audiology, which is happening this year after our AudBoss Summit, which we'll talk about later. And one of the two talks, they've asked me to do two talks, and one of them is about private practice growth. And I think one of those things about growing a private practice is using the right tools, right? So having the right tools, providing the right services for our patients. You guys created something that's such a powerful tool on building this relationship with patients, on explaining, what's going on with their hearing loss and their hearing tests. So can you guys talk about HearVu and how it works, especially with the patient journey?
Yeah, I'll just start with a little bit of the why behind it and then hand it over to Eric to talk a little bit too. Yeah. I've always felt like there was this really big disconnect in our profession where we all go about gathering information in relatively similar fashions. But when it came to transitioning to counseling, everybody was doing it in a very different way. And we were taking a very confusing graph that's unfriendly and making it more unfriendly by drawing all over it and putting arrows and circling things that we weren't delivering with great clarity. And I was kind of on this mission to solve this disconnect of how can we gather information, counsel our patients, transition into recommendations, but never feel like we have to sell anything. Students come out of school knowing how to do an audiogram, few come out knowing how to talk successfully and comfortably about the audiogram. And also transitioning from that counseling into the sales is very awkward for a lot of people. And so I'll say that HearVu really was kind of born out of the passion for my interest in connecting with patients, being a teacher, leading patients in the direction of taking ownership. It's been a lot of fun to bring the audiogram to life and to finally talk about the audiogram in a fun way.
Yeah.
And it was really just a tool I was building just for my practice. And when we started dealing with the first and second generations and Eric and I started working together on it, we realized that on a daily basis, we were having patients say to us, nobody has ever explained it to me like this. I finally understand my hearing loss.
Yep.
And enough of hearing that and creating the empathy and the compassion that was being infused into our office, we thought, why shouldn't every patient have the opportunity to truly understand this crazy graph that we try to bring clarity to?
Right.
And why shouldn't every provider have a fun way of talking about the audiogram and an easy conversation with the patient?
Absolutely. And, before Eric, you jump in, I just wanted to explain, I actually shared, you guys spoke at the 2020 AudBoss in Denver, and I shared that video. I share it with our students that rotate through my office, these audiology students from Cal State Northridge, and every single one of them has said, wow, why aren't we learning something about this in school? And I'm like, well, you learn, kind of the basics. And then now we jump into something like HearVu, where it really takes it and really expands on that. And again, makes that connection and that empathetic connection with the patients.
Yeah. And I think we just take this like complex situation of hearing loss and we put it on this piece of paper and then we write all over it and expect the patient to understand and want to seek treatment. I mean, everyone always talks about how do you get patients to move forward? And it's by creating that relationship and understanding. And that's really what HearVu has done. I mean, even as a new audiologist, it gives you a consistent process to say, this is how you counsel your patients. And it all starts with education. I mean, as I was a student, you go to all these different practices and you understand what their process is. And then you come here and it says, by better educating your patients, they make the decision to move forward with treatment. And so then we've put that into a software that walks the patients through that journey together. And it's been, remarkable. It's been fun.
It's a great educational process, right? And I think it's a great teaching tool. I think students could really use this, and I think that could be something, set up in a university setting for teaching as well. Something to think about, guys. And of course, you guys didn't just make this up and just started distributing it, right? I'm assuming you guys have done some beta testing and stuff like that.
Yeah, so we did partnered with Elite, and we've done 2 beta studies so far. We're in our 3rd one. And what we did was we just put software in the hands of practices. And so the first 2 beta studies were 30 practices. And the 3rd one is another 30 practices that have been using it. We looked at all sorts of different, metrics. Because everyone likes, to build that empathy. And so a lot of it was an emotional aspect. Mm-hmm. Then it was numbers. Does it increase close rates, treatment rates? Are you more productive from a production per hour? So does it increase your appointment times? All sorts of different things that we looked at during these 2 studies that we've completed so far. And it was really fun because, I like to look at the numbers, but also the first study was set up as 3 weeks on, 1 week off to look at all the numbers, and then another 3 weeks on. And so when we turn the software off on the iPads for everyone, we had so many practices calling us and saying, I need it back. I have an appointment at 11 o'clock and I have to use the software. because you get addicted to it. When we first started, we only had one. And so I would run to Robin's office and steal it for my patient. She'd run to my office and steal it. And so it's that same kind of concept. Whereas once you put it into your process, you say, I need this tool to better educate my patients. I mean, it just builds a different compassion and empathy in your appointments.
Absolutely.
And we've seen that here. And it was fun to see that through the 2 different betas that we've done, is that other practices loving it and enjoying it.
Yep. And you touched on appointment times and efficiencies. And, of course, the big elephant in the room this past year was, of course, the pandemic, and how a lot of us have had to learn how to almost rebuild our businesses and how to generate revenue again, and appointment times being as efficient as possible. So how can HearVu help with increasing revenue and making appointments more efficient?
What we've seen, especially as we take students that come out of school and new audiologists that come through the practice, is a better way to train more quickly and get our green audiologists up to speed and generating revenue for our practice, because we're over that hurdle of the awkward transition from counseling to sales and recommendations. For us, it has not added appointment time. It does not subtract appointment time necessarily. Whether you're a 60-minute new consult or a 90-minute new consult, you're going to deliver the information in a fairly similar manner, or in terms of pace, it's not going to increase the time. But what I know as a practice owner, as we grow, is that I am certain that every patient that walks through these doors is getting the very same experience in every office.
Right.
And they're all being told the same information in the same order.
Yep.
So it's streamlined our process, and it kind of puts a nice bow tie around the patient visit. It's also allowed for us to be able to train our audiology assistant to counsel on annual audiograms, shifts from baseline. Now she can talk meaningfully about the audiogram and not take my time to do that. We looked at our numbers that were given through Elite over a 4-year span of time, and we're able to see our billable hour increase significantly over the typical. Our close rates are good, or help rates are certainly above the norm. And so it is something that's going to take that patient that you can't quite drag over the finish line,
right.
Reduce your tested, not treated patients, because if you can remove denial and you can remove lack of clarity from the appointment visit and really get everybody on the same page and making a decision to move forward,
right.
It really does help improve the bottom line.
It just makes sense, and you end up creating a duplicatable process that can span across multiple providers.
Yeah, I think just what I've seen is that, I mean, I would get done explaining an audiogram, and then you say, well, do you have any questions about it? Then you get 15 questions about what you just talked about. And you're like, yeah, this is what a low frequency is. This is what a high frequency is. And so by giving that thorough explanation for patients, you stop those questions, and then you move on to together, how do we treat it? You start going on to those questions, is that this is the different styles of devices. This is the different levels of technology, and based on your lifestyle and everything. So, I mean, it takes away from going over everything that you just talked about to moving, this is the next step. And we've seen that just from feedback of the people that have bought the devices, is that even for third parties, I know that's a big thing now,
right.
Is that it takes that off, and then you can move on to different things. So do they need a service plan? I mean, every aspect, it just gives you a consistent process where you can say, you can talk more about treatment and less about what's wrong with you.
Right. And try to keep it more on a positive spin as well.
Definitely.
Absolutely. So I'm seeing a lot of ideas here. So what about, instead of just the patients, could you use this in marketing and outreach as well?
I love this question, because this to me was kind of a side benefit of HearVu. I have a pharmaceutical sales background and love getting out into the community and talking to physicians and nurses and nursing homes. And we all know that so quickly, all of that time that we spend, there's nothing exciting to bring to the table anymore. And so we took HearVu into some of the practices locally that we knew the doctor valued the patient education and the time and the commitment and the interest and the relationship. We have had great result, because you're leaving something for them to be top of mind that's really very remarkable. When we take it into the doctor's office so quickly, as they dismiss a mild high frequency hearing loss because they don't understand the implications of that. But when they can hear it, and you can actually touch the audiogram and move the audiogram for the first time, and then simulate what that sounds like, it really gets everybody excited and nurses and nurse practitioners, everybody's kind of huddled around HearVu, touching it and interacting with it. And it really it's a great leave behind without leaving anything behind other than well, that's pretty cool. So we have seen an increase in our physician referrals as a result of bringing HearVu into the community.
Yeah, I mean, we've done everything for physician marketing. We do packets, we do bagels, I mean, whatever we can think of at the time. And so we went to a physician, and we brought HearVu. We said, this is what your patients are experiencing, is that our goal is education. And by educating them, they make a better decision for treatment. And it's been huge for our physician marketing.
Right. Yeah, that's actually pretty neat. That's a smart way to do it, because I know that I come from a physician family background and a lot of my friends are physicians. A lot of times I ask them, what do you want from us? And they generally don't want the big packets of information. They just want us to tell them, hey, this is what hearing loss is, or tinnitus is, or vestibular, or whatever, and then let them make that decision on sending it out. But the way to educate them is so important, because if you don't educate them right, then they have the wrong information. So that's extremely important.
And really, I mean, they just want to know that their patients are being taken care of.
Yeah.
It says, this is how we do it here, and we really care.
Absolutely. I'm a big fan of physician relationships, right? So this would be a very smart way to do it. Now, when we heard from you guys in Denver at the AudBoss Summit, obviously it was a very powerful tool. Have you guys made any additions to the software or to the tools itself since then?
Yeah, so I mean, a lot of people are using it now. Everyone has different things that they want out of it, which is fun. I mean, we even use it 2 different ways. And so we've made a lot of updates to it, just from like before the normal line was at 25 decibels, and now it's variable. And so whether you're testing or whatever your normal is, you can now vary at that. So you can put it at 20, 25. And so really practices have more adjustments that they can do to it based on that, which has been a huge thing for it.
And we're excited. I mean, a lot of the practices talked about how impactful or helpful it would be for the Spanish-speaking population. And so we're really excited to know that that's in the works right now. And we're going to put that into the hands of people who are fluent in the language and can give us feedback. But what a great way to communicate when there's a language barrier and to help those people really understand.
Absolutely. I mean, we just had that happen like a couple of days ago, where I quickly ran on Google Translate and typed out everything I wanted to say to the patient, and then copied it over, put it in Word, and the patient sat there reading, and then he responded to me in Russian, and I thought, I can't understand you. I wanted to push this information, not so much pull the information. And so, I completely respect that idea, and having it in Spanish language, or even having that customizability, is so great. And you guys, anybody who's interested in HearVu can go to www.hearvu.com.
And it's spelled a little different. It's HearVu. So
I'm going to have it written right down here.
Fabulous.
So anybody who wants to go can go right to that website. And you guys have offered our audience here a very sweet deal as well. So of course I appreciate this. If you go to hearvu.com and you sign up for HearVu, you'll actually get a 15% discount if you use the code AudBoss, which also is written right here. And all this information will be down in the description as well. You guys, I really appreciate this. Is there anything else you guys want to talk about HearVu before we wrap up here?
No, I just want to thank you and April. AudBoss has been a platform for us to really meet a lot of people, get great feedback. We had really super success at the first conference, and have made some great relationships as a result of AudBoss and HearVu. So thank you.
Yeah. It's been fun just seeing on AudBoss, and everyone just starting to use it and then share their experiences and make videos on it and post it on different things. Is that this is what we're using for our clinic, and just how it's changed their process too. It's been fun. Yeah,
I think I just saw a post yesterday, the day before, and the first sentence said HearVu for the win, right?
Yeah.
I think it was Jason who posted that, and
love it.
He did something that worked for the patient. And we're going to see you guys in the fall at the 2021 AudBoss Summit, which so far looks like we're cruising. So we are looking forward to. Yes, I'm very confident at this point. I was a little nervous about it a couple months ago, but not so much anymore. So we're going to be sitting out in the sun with everybody else. You guys are gonna be on stage as well again, so we appreciate you guys doing that. And for more information about the AudBoss Summit, again, you'll see the links right down here. And Robin, Eric, I really appreciate you guys. Thank you for taking the time today for talking.
Thank you. Good to see you.
Okay.
Appreciate it.
All right.
Bye-bye.